I first saw Mr. Sufiyan, a 38-year-old gentleman from Kurdistan, Iraq, about 4 months back. He came to my outpatient clinic with increasing complaints of right hip pain and also with the discharge from his right thigh, which was persistent for a few years now.
السفيان مش عراقي مش خانة سوري الده زارو يانزدي حادثة قلبان متشيبو بريندار بوم شو موان مستشفى العراقي عملي كرمو عملية دوان تقصير نقرنجي بس بعنا نجحين نسيبو الده زارو وبانزي شوما الألمانيا شوما دسي تختورا قوتن قوم نكارن تعملي كنجبر بكتيريا قلق اللنجيتا ديا.
To give you a brief history, he was involved in a blast injury back at home in 2011, which sustained with fracture as well as multiple injuries of shrapnel to the right hip. For the first 3 years, he was conservatively treated at home, and then he was put on a spacer, after which he noted he could no longer walk. Following that, he went abroad to Germany, wherein the infection was treated and then a right hip implant was placed.
تختوري قبلي أسكارم زي عمليكم أو تختوري عملي كرم بلاتين كرلنجي مدا وبكتيريا شغلي سي دا عملي ديجي دانمي وفيد النبو المهم آخر شي قوتمك وهذا وخلاص تشتغنينا وهرم على أخوة أصحاب مبقريا مع عراقي ديسا مشاكل جمرة تشيبونو إيش تشيبو بكتيريا تشيبو أم چونا أردن 2019 أشوما أردن بعد دكتورة كيلويدري.
Unfortunately, his trouble did not end there. This subsequently got infected, and he had subsequent 2 more surgeries in Germany to get rid of the infection. Although it was okay for a few more days, then he noted when he came back home that he had a persistent drainage from his right thigh, which subsequently increased. He also had a shortening of his right hip, and the pain in the right hip gradually increased.
أو ممثلي مستشفى مانيبال العراقي قوتم قوورا بامو أشياء وفحوصات خامودانتي هاتا أو بخواهاتا أهندي مستشفى مانيبال بنغالور تشتوى مدانة تختورو بشتينجيتي سالا مقر قوورا.
After a few more years, he came to us about 4.5 months back with these complaints. On examination, we saw that he had a right hip implant already there in place, and there was a purulent non-stopping discharge from his right thigh. So this was a clear-cut indication that there was a persistent infection after a joint that was in place.
هادنا في دري فحوصات وما قرتن تقريبا 10-15 روجا فحوصات وتشتو أو همو دكتور بشكل دقيق صار سكني وهمو تشتشي كاندنو همو فحوصات وكرن دكتور سونيل وبشتي هنجي دست بعمل ياكر جوزبي بلاتيني راكم ودرمان كميتيو درمان دانمي وتقريبا أسدهي فامام ديسا عملية كديدامي والزكي عملية بخدا.
So we explained to him that he would need a couple of more surgeries to get rid of the infection first, and then once the infection cleared, then we can put on definitive prosthesis. So we did 2 subsequent surgeries to clear the infection. First time he did not grow anything. Second time we identified the organism and put him on IV antibiotics for about 6 weeks. Once the infection was cleared, then we did the definitive surgery, which was introduction of what we call as a proximal femur replacement prosthesis. Because his whole thigh was destroyed by infection, only the lower third of his thigh was remaining, and so we had to put a long stem prosthesis, which we call as a proximal femur replacement.
ممنون استعفي سيستراجي أوجي يعني الواجبة كي دقيق مفرابون هر نفس الحالة فيزيوثيرابيجي واجبة كي دقيق مفرابو ولنجي متشي قرنو أزقلق ممنون مش هموكا وش دكتور سونير وش مستشفى مانيبال وإن شاء الله هر سركدي بمستشفى وإلى هر نساقي هذا غير إن شاء الله بخير وخوشي وغر يا مالا خوا وقلق ممنون.
So he's been almost a week post-surgery. He's doing extremely well. The infection is almost cleared, and we hope that he's going to stay infection-free. After a long time, he's finally stood up on his feet. His length of his leg has been got back, and he remains symptom-free to this date. And he will require a good extensive physiotherapy to get back to normal activities, which I believe he will. So these kind of complex joint replacements, revision joint replacements, are done as a routine part at our joint replacement center in Manipal hospitals. We have all the expertise that we require to do this kind of extensive surgeries and a good rehab team as well.